Good evening, everyone. Thank you so much for being here with us tonight. We're so excited to share with you some of our amazing presenters and experts. And the purpose of this town hall is to answer your questions surrounding COVID. We will briefly hear from our panelists, but we're going to give you ample opportunity to make sure that your questions surrounding COVID and the COVID vaccine are answered. A couple of ground rules. So this is a community event. Please be respectful of other participants and your actions and your words. And remember that we're all learning. So please don't hesitate to be curious and send questions in the comments. And finally, we want everyone to be able to enjoy themselves and feel safe. And so we'll take the appropriate measures to ensure everyone's well-being. I would first like to introduce Mrs. Lachelle Wardell, the Community Outreach Engagement Manager for COVID with Wake County.
Good evening, everyone, and thank you, Dr. Monroe. It's my pleasure to be here tonight, and I'm excited about tonight's panel discussion. Just a quick note of housekeeping before we get started into the conversation. We do have a quick poll that we would like everyone to complete, all of our participants to complete. So if you will allow me to share my screen for just a second, I will put up the link to the poll here. Okay. Does everybody see that? Okay. So if you will use your device and put this link into your device, that could be your laptop, your computer, your cell phone, and you will be able to take our poll. At the end of the night, at the end of the conversation, we will come back up and look at the results. So I'll give you a few seconds, just to jot that link down. And Stacy is putting it into the chat in YouTube so that you can click on the link there. Thank you, everyone. I hope you have a great conversation tonight and get all your questions answered. I'm going to stop sharing.
Excellent. Thank you so much, Lachelle. So first, I'll introduce myself. I'm Dr. Rasheeda Monroe, a pediatrician and medical director of primary care pediatrics at WakeMed. I also serve as the campus director to UNC Raleigh for the School of Medicine and the director of the Kenan Urban Scholars program. I am so pleased to introduce the first of our panelists, Dr. Jamila Fletcher. She's a Raleigh native. She graduated from both Duke as a prestigious BN Duke's Leadership Scholar and from the UNC School of Medicine. During her residency at UNC, she was designated as an Ambulatory Pediatrics Association New Century Scholar, recognized as with her potential in leadership in pediatrics, with an interest in areas of cultural competency and health disparities. You will not see any pictures of Dr. Jamila Fletcher getting her COVID vaccine because she got hers unknowingly months ago when she enrolled in the phase 3 Pfizer vaccine trial with 44,000 other Americans, not knowing if she was getting a saline shot or the real thing, not knowing what side effects she might experience short-term or long-term. She admits it was a gamble. She'll talk some about her experiences in the live discussion. Welcome, Dr. Fletcher. Do you want to tell us a little bit about why you're here, how you're involved in COVID vaccine work?
I'd love to. Thank you so much for that introduction, Dr. Monroe. I am so happy to be here. As a primary care pediatrician in the community, I play a role as far as testing, diagnosis, quarantine. We have a curbside clinic in our practice where we do testing on a daily basis. And then we follow up with our patients via telehealth and some in person. As you also mentioned, I'm vaccinated. So on a personal story, I can talk about whatever side effects I've had. This was back in the fall during the phase 3 trial. So I'm now months out from my vaccine if people have questions about long-term side effects. I'm also an advocate for community vaccination through strike teams with Wake County. as well as through some church organizations, including my personal church, where I've sat down with many members of our community, our congregation, and answered their questions as well. So I'm very happy to be here.
Thank you so much, and thank you for being a vanguard in the vaccine trial aspect, and we'd love to hear more about that experience. Next, we have Dr. Nicole Mushonga. Dr. Mushonga is a Wake County Government Associate Medical Director and Epidemiology Program Director, and she's been on the front lines of preventing COVID-19 spread and testing for the largest county in the state. A graduate of Indiana University School of Medicine, Dr. Mushonga was a postdoc fellow for addictions and health disparities at the University of Houston, Texas. She's an experienced leader with demonstrated communication, statistical analysis, and research knowledge, helping lead the public health team as they try to fight the spread of the virus. For Dr. Mushonga, the fight is personal. In April, just as the pandemic was ramping up, her mother, father, and grandmother were all hospitalized with COVID-19 at the same time. And unfortunately, she lost her grandmother to the virus. So Dr. Mushonga, thank you so much for being here to talk about your personal experience and the work that you've been doing. Tell us a little bit about why you're here and why you're doing the work.
Dr. Monroe, thank you. Thank you all for having me tonight. As you've mentioned, my role has really been involved with this operation from the beginning. Wake County was the first county to have a case of COVID identified, also first in the state of North Carolina. And from then, my role has been assisting and leading our county through the response, through our peaks that we've had in the summer, and even through this very large winter surge that we're starting to now come out of a bit. As you mentioned, this is personal. So it's very important that I'm able to share the data and the things that we're seeing here in our county and how it's impacting the lives of our residents, but also to speak about my personal experience. So if there are any questions, please feel free to ask. I look forward to speaking to everyone tonight.
Thank you so much. We appreciate your time and look forward to hearing more from you. Our next panelist is Dr. Edward Okran. He's been a pharmacist at WakeMed for the past 14 years. For more than a decade, he has served in a leadership role, currently serving as the pharmacy manager for WakeMed Care Hospital, where he oversees all pharmacy operations. He is playing a key role in the pharmacy team that is assisting with the critical COVID vaccination rollout for WakeMed Health and Hospitals. Thank you so much for being here, Dr. Okran. And can you tell us a little bit about the work you've been doing and why you're here?
Thank you, Dr. Monroe, for the introduction. I'm really excited to be here. First, I'm going to start off on a personal level. I've had friends and family members that have had COVID. Just last week, I actually lost an uncle. My dad's youngest brother passed away from COVID. He had COVID symptoms. It got worse over 3 days, went to the hospital, and passed away like 2 days later. So I've experienced it from a personal level. In terms of what we've been doing currently with regards to vaccine rollout, the pharmacy department has done a lot of assistance with regards to getting doses ready, storing doses, making sure doses are stored appropriately, and making sure that the providers and physicians and nurses that will be administering the doses have what they need. And also in the hospital, we've been at the front lines trying to take care of patients from our first peak to our current peak and all the highs and lows that have come with it. So I'm really excited to be here. I'm ready to answer any questions that you guys have.
Great. Thank you so much, Dr. Okran. And I will say, as the Community Strike Team members, have really appreciated your help and support day of and boots on the ground with pharmacy support. So that's been wonderful. All right, so let's get started. We are going to go into our Q&A round. And again, we want to give you ample opportunity to be able to ask our experts. So you've met our 3 panelists who are live with us right now. But in the chat, we have other experts that can help answer your questions. Our chat moderators are Dr. Michelle Benoit Wilson, who will respond to questions related to women's health and fertility. Dr. Craig Fletcher, who will respond to questions related to the vaccine, manufacturing, and safety. Dr. Stephanie Etienne, who will respond to side effects and myths. And Dr. Michael Spiritos, who will answer questions about how to schedule an appointment at Duke Health or how to access Duke-related health information regarding COVID-19 and how institutions are prioritizing historically marginalized communities. Let's get started. So, one of our first questions, and Dr. Mushonga, this question may be for you. What's the best way for an organization or church to reach out to its members and locate people who have not been vaccinated? Once this information has been gathered, how do we assist them to get vaccinated? What's the best source of information? And this question comes from one of our participants, Denise Spa. Denise, thank you so much for that question. Dr. Mushonga and Lachelle Wardell, who is also on the call, can you help us answer that question?
Thank you, Dr. Monroe. I will have Lachelle answer that. She has been working closely with our community engagement, so I know that she can provide some great information on that one.
Thank you. Thank you for the question. So the question is, how do we engage churches and reach out to make sure our community partners are participating? We've got a process where we reach out to our historically marginalized communities based on positivity data. We look at the data, see where the highest needs are, and then we identify partners or churches or community organizations that are in that community that are interested in hosting COVID vaccination or testing sites. We then reach out to that church, that organization, ask them about their interests, their availability, and overwhelmingly, we've had overwhelming response with churches and organizations wanting to serve their community in that way. They provide the volunteers, they do all of the registration up front, and they provide the logistical end of that, and either WakeMed or Wake County will come in and actually administer the vaccine. So it's been an absolutely wonderful process. We do have a form that we would ask any community organization that's interested in being a future site to complete. So I will try to put the link to that form in the chat. So anyone who is interested in thinking about that in the future, you can have access to that.
Lachelle, thank you so much for that information. And before you go, can you just remind us, how do people get registered for the vaccine? And if they have questions, what's the best source of information? And so if they want to go on Wake County's website to register and get on the wait list, and then where should they go for the best source of information?
So they should, again, go to wakegov.com. There's a COVID-19 vaccine/wakegov.com. That's how you register to get on the wait list for that. And as it only registers you according to groups. So we are currently still in group 2. And so that's 65 and older and essential healthcare workers. Those are the only 2 groups that we're currently vaccinating. So they would go online to wakegov.com to register on that, to get signed up for their wait list, and then they'll be called for appointments. There's also a COVID-19 questions line that they can send questions to, and I will ask that if our communications specialist is in, if she can post that link to the question line, and we will have someone to respond to questions.
Excellent. Thank you so much. The next question comes from Regina Petaway. Is it true that the 2 vaccines approved for emergency use do not keep you from getting COVID-19? They only keep you from getting it to the point of needing hospitalization or dying. Dr. Mushonga, do you want to help answer that question? Thank you so much, Regina Petaway, for sending in that wonderful question.
Sure, yes. Thank you, Dr. Monroe. So what we know from the data currently is that the vaccines help prevent high-risk cases of death and severe illness, so those being hospitalized. We are still doing a lot of work and a lot of research to understand just if and how it can prevent transmission. So we are still in the early stages, and there's still a lot to understand about what's happening and how it can potentially prevent transmission.
Thank you so much. The next question comes from Trinesia Martin. Trinesia says, do you feel like there's been enough time to test the vaccinations? Is there a concern that it may not protect everyone? Dr. Fletcher or Dr. Okran, Dr. Fletcher, you were a part of the vaccine trials, and Dr. Okran, you've, as a pharmacist, have been deeply involved. Who wants to answer that question?
I'd be happy to answer the question since I was involved in the trial initially, and I kept a close eye on the data that was presented to the FDA for the emergency use authorization. And when you actually look at the volunteers that were in the trials for Pfizer and Moderna, the 2 mRNA vaccines, there was a great distribution of ethnicities and races that were represented, at least 10%. But more importantly, they did a good job of including people who had high-risk conditions. So things like obesity, hypertension, diabetes were included. So we do feel, based on the data, that these 2 vaccines in particular, Pfizer and Moderna, will represent our community and those with high-risk conditions.
Dr. Fletcher, a follow-up on that question from the same viewer. Trinesia Martin says, have there been cases of folks who have been fully vaccinated, still infected with COVID-19?
So you do not want to actually actively be infected with COVID before you get your vaccine. You want to make sure that you are no longer contagious, if I'm understanding the question.
No, I think what she's asking is, after you get fully vaccinated, so you've gotten your 2 doses and you're 2 weeks out, could you still get COVID-19?
I see what she's saying. So if you've already had 2 doses, the efficacy is about 95% for both of the mRNA vaccines. So that means that it's not 100%. So that's why you still want to wear your mask, social distance, and wash your hands, all of the public health measures that we are doing before you're vaccinated.
Thank you so much. And to Dr. Mushonga's point earlier, the good news is that even if you are to get, were unfortunate enough to get COVID after being fully vaccinated, the risk of it being severe or even causing death is much, much lower, after you've been vaccinated. And that's the real benefit of the vaccine, is that it's life-saving. So thank you so much.
And to add to that point, just looking at the data from both Moderna and Pfizer, of all the participants that actually received the vaccine, Pfizer did not have a single person that was hospitalized, and Moderna had only 1 person. So we're talking about 1 out of 30,000 patients that actually received the vaccine. So that's really, really good.
Awesome. Thank you so much, Dr. Okram. That's very helpful. The next question comes from Phyllis Cunningham Boykin. If someone is hospitalized for COVID-19, will they receive the vaccine before they're released from the hospital, or will the vaccine be recommended later after release? Thank you so much, Phyllis, for that question. And Dr. Okram, do you want to go ahead and answer that question for us?
Yes. So if you are hospitalized, you're not automatically going to receive the vaccine in the hospital, especially depending on the type of drugs that are received in the hospital. There are certain drugs called monoclonal antibodies, for example. If you receive those whilst in the hospital, you have to wait for 90 days before you can get a vaccine. Also, you want to make sure that you're completely recovered from the disease before you can get a vaccine. So you don't automatically get vaccinated whilst in the hospital.
Thank you so much. Phyllis has another question. Are some physicians in private practices being given the COVID-19 vaccine for distribution to their patients? If yes, how is the vaccination process being monitored for equity purposes and inclusiveness, or is it? Dr. Mushonga, do you want to help answer that question for us about equity and distribution and who's receiving the vaccine from a physician and private practice versus hospital and government agency standpoint?
Sure. So I can speak a bit to the public health and the hospital section. I know that currently the local health departments and hospital systems have been receiving vaccine, but there is an opportunity, there will be an opportunity for private physicians to sign up to become a provider in the system to be able to provide vaccine. The state of North Carolina is monitoring sort of that equity piece. You can go onto their website and you can see the distribution of the vaccine from dose 1 to dose 2, county by county. You can see it by race and by ethnicity. So that's a way that the state is able to be transparent and show you what is actually happening in the community.
Excellent. Thank you so much. We have another question from Winston, who sent in, if COVID is so high in the Black and Brown community, why is there lack of vaccine?
So I can take that one as well. It really comes down to allocation or the amount of vaccine that is currently available. Right now, the demand is really high for the vaccine, and there's just not enough supply to go around for everyone. And so the state has provided guidance on looking at priority groups. One, looking at groups that are at high risk or high risk of exposure, and being able to make sure that those groups are able to be prioritized to receive vaccine. Yes, there is a concern because we see that within our community, particularly when we looked at Wake County, about 31% of the deaths that have been associated with COVID have been in African Americans. We make up about 21% of the population of Wake County. So that is concerning, but that is the reason why we're having sort of these conversations and getting word out and trying to educate everyone and educate the community on the need for the vaccine, as well as continuing to do other preventative measures.
Thank you so much. Let's see, there's a question from Shirley. If you have COVID or have had it, can you still get the vaccine? Dr. Okran, do you want to answer that question for us?
Yes. CDC still recommends that if you've had COVID, you still need to get a vaccine. The reason being, currently, we don't know how long, if you get a COVID vaccine and they have natural antibodies, how long it's going to last in your system. So it's still good to get a vaccine. Depending on the type of treatment that you receive whilst you have COVID, you may have to wait for up to 90 days before you can get it. And also, you definitely need to wait till you are completely healed and you've gone through all the quarantine period before you can get a vaccine.
Thank you. Amy Castillos asks, Is it safe to get vaccinated while you're pregnant? And one of our women's health experts in the chat answers, although pregnant women were not included in the vaccine trials, the current recommendations from various women's health groups is that pregnant women be offered a vaccine. This is especially important if the pregnant woman is a healthcare worker or otherwise is in a high-risk group. Thank you so much for that question. Dr. Okram, while I have you here, Vielka Gabriela asks, if an individual, for whatever reason, misses their second dose, will they need to start over?
No, you don't have to start over. CDC recommends right now that if you miss your second dose, or if your second dose is a little bit out of sequence, you can just go ahead and get it at the earliest possible time. So no, you don't have to start over from getting a new first dose if you miss your second dose.
Thank you. Dr. Mushonga, Marjorie Hernandez asks, my mom is 40 and has diabetes. When do you think she'll be able to get her vaccine?
And so as the state begins to open up new groups, that's when we'll begin to see more and more people be eligible to receive their vaccine. As I kind of mentioned a bit earlier, that our groups are based on those that have the highest risk of exposure and the highest risk of death. And so using that information, group one having been those high-risk healthcare workers and long-term care facilities, and group two, those 65 and older, and moving down into the groups. So as we begin to open up more groups, we'll see that the eligibility will open up a bit more. When that happens, we don't know just yet, but we are hopeful that it happens soon. Once again, it's just based on the availability of the vaccine and being able to supply that to all those who want it.
Thank you. And Dr. Mushonga, again for you, how is Wake County ensuring that there are no doses going to waste because of people who fail to keep their appointments? Are others on the wait list called for? And that question comes from Prabha Shankar.
Yes, so we have a great vaccine program that is and has a really great vaccine team. One of our communications members is a part of that team, and I believe she's going to speak a little bit more on that process. Stacy?
Hey, Dr. Mushonga, thanks so much. I hope everybody can hear me. We definitely want people to sign up for vaccine, obviously, if you are in the groups. And right now our wait list is taking those folks. And so far, we've been able, as Wake County Public Health, to vaccinate more than 25,000 people. And of those 25,000 people, we have only wasted 13 doses. And that's an incredibly low percentage. And by waste, we mean not no-shows, not doses expiring on the shelf. It might be that our clinical staff has, for example, mixed 2 milliliters of vaccine instead of 1.8 milliliters. Those errors are immediately caught, corrected, and coached in the moment. So that's a great percentage. And one of the other fantastic benefits, Dr. Mushonga, you know this, of our appointment system is that we are able to constantly monitor our appointments. And if we see that there are openings throughout the day, we are immediately activating people to fill those appointments. So at the end of the day, we don't want any to go to waste. And once we get through those on our wait list and we have additional vaccines from the state, we open up new appointments and invite more people to join. And at this rate, we've been able to vaccinate about 2,000 people a day in Wake County. and hope to have a capacity of almost 10,000 a week going forward if we continue to receive the increased amounts of vaccine from the state that we're starting now to see.
Thank you so much. Dr. Fletcher, this question goes to you from Anonymous. And the question is, you say that Black and Brown communities are at high risk, but we're not interested in taking the vaccine because we don't know what's in it. So a lot of people we know in historically marginalized communities, Dr. Fletcher, have some hesitancy and mistrust surrounding the vaccine. How do you address that?
Well, thank you for the question. It's a good one. And it really speaks to the heart of why I volunteered in the study in the first place. It's because of historical mistrust and honestly frank abuse in the past of Black and Brown communities that there is this mistrust that's led to disparities. And so because of those disparities, we are more vulnerable and have the conditions that put us at high risk for not only acquiring COVID because of either our jobs, but also conditions like we mentioned before. And so I knew about this mistrust and the disparities, and I wanted to represent as a Black woman in the study for our community so we can say that we're included in the data. And I also want to back up and say that those feelings come from a place that is real, and we do need to acknowledge that as a medical community. And also recognize that because of the Tuskegee experiment and other like Henrietta Lacks episodes where people were not consensual participants in a study, things have changed a lot since then. And so when I participated in the study, I got informed consent. I read the IRB, which is basically the scientific what they're doing in the study, what the treatment is, what the placebo is, what the potential risk could be. And so all of this is accountable, and there are systems in place now to prevent those harms that were done in the past.
A follow-up question for that, then if the vaccine isn't 100%, Dr. Fletcher, why should we take it?
Because if you don't get it, it's basically 0%. So 95 or 100%, it's all better than 0%. And as Dr. Ocran mentioned, it is 100% at preventing death and hospitalization, and that's really our goal.
Thank you. That question, thank you so much for sending that question in, David Chikaff. Dr. Okran, this next question goes to you. Is there a difference in the first and second vaccine as it relates to strength and makeup? And that great question comes from Mary Hood.
So the two vaccines that we have on the market currently now that's been approved by the FDA is Pfizer's COVID vaccine and Moderna COVID vaccine. The technology behind both vaccines is the same type of technology, but there are several differences between the two vaccines. For example, the Pfizer vaccine, the dose is 0.3 ml versus Moderna, which the dose is 0.5 ml. The way the vaccines are stored are different between Moderna and Pfizer. Also, a lot of drugs have what we call inactive ingredients. So like things that they add to the drug to make the drug stable, for example. They have different inactive ingredients in the Moderna versus Pfizer one. So even though they do the same thing and the technology is the same, there are sort of subtle differences between the two. Also, the dosing schedule is different, even though both vaccines require 2 doses. The Pfizer vaccine, you have to get your second dose 21 days after, versus Moderna, you have to get your second dose 28 days after. The side effects profile is very similar. Both of them, you get, the side effects that you get actually side effects from the drug actually working, doing what it's supposed to do. So you get things like headaches and muscle pain at the site of injection. You may feel lethargic, get a little feverish. That's sort of the same across the board. But other than that, but they both have the same efficacy. Both of them are about 95% efficacious and almost 100% preventing death and hospitalizations.
Thank you. And from Pfizer dose 1 to Pfizer dose 2, is that the same volume and ingredients in that vaccine?
Yes, from Pfizer dose 1 to dose 2 and Moderna dose 1 to dose 2 is exact same drug, exact same volume, exact same ingredients.
Thank you. Dr. Mushonga, this next question comes from Marjorie Hernandez. What is the price for the vaccine and does it vary for everyone?
It is at no cost. That is for everyone, no cost for the vaccine. There is no variation. You should not have to pay to receive your vaccine.
And along those lines, what type of proof of identity or job do you have to show to get the vaccine? Do you need a government ID to get the vaccine?
So to receive the vaccine, we wanted to make sure that we eliminated barriers for individuals so that anyone within the state of North Carolina, they could receive the vaccine even if it wasn't necessarily in their county. So eliminating those things that would require you to provide proof of your address or your job. But we are encouraging people when they fill out their registration form, it'll take you through that process. You'll answer and select which group you're in. And that way you'll be able to know exactly how the registration works and then when you will be notified.
One more follow-up question comes in from Vielka Gabriel. Given that proof of residency is not required to receive the vaccine, do you believe this may cause a shortage for Wake County residents, especially for those who don't have transportation to go outside our county to be vaccinated? So people with transportation who are able to get to our county, are they coming and taking vaccine? I think is the question.
So the way that we have set up the system, we want to make sure that when individuals are invited, it is by appointment. So these are individuals that have registered in the system, and then from our system, they are invited to come and to receive their vaccine. That process is using the information as far as zip code and location, so that we are making sure that we are doing an equitable distribution. And it's always by appointment with our system.
And this is Stacy with Wake County Public Health Communications. We were just asked about PNC Arena on the first week that we opened it. How many people drove in from outside of Wake County? 96% of the people who were vaccinated at PNC in our first week were Wake County residents who lived or worked in Wake County.
Excellent, thank you, Stacy. Dr. Okran, I want to send this next question to you. Terry L. Clark asks, those who have high risk conditions like diabetes and obesity, have they had more side effects than those who don't have those comorbidities or high risk conditions?
So far, based on the data that's been reported to CDC and FDA, there isn't really any trend that shows that if you have any of these high-risk conditions that you ask about, that you're necessarily going to have any more severe side effects than someone that doesn't have those high-risk conditions. So There isn't any particular trend that's shown any disease state to produce any higher side effects than someone that doesn't have the disease.
Great. Dr. Fletcher, David Chica asks, my job is offering to pay me to take the vaccine. Why would they do that? It makes me suspicious. What do you think about that, Dr. Fletcher?
I think you work for a great employer. They do that because they don't want to have an outbreak in the workplace, and they also want to make sure that they have workers that are able to attend, because if you get COVID, you're going to be out for 14 days. So that's lost productivity. So it's pretty much a win-win for employers who can offer that.
Thank you. Dr. Okram, Leonardo Williamson asks, the Johnson & Johnson vaccine will be available soon. Can you share how it differs from Pfizer and Moderna vaccines regarding effectiveness?
So the Johnson & Johnson data came out not too long ago, and it's currently still under review by the FDA for emergency use authorization. The data Johnson & Johnson presented, the efficacy was a little less than Pfizer and Moderna. For the US, it was 72% efficacious, but it also prevented hospitalizations 88%. I think a lot of people look at that data and they sort of get keyed in on that 72%. They really need to be looking at that 88%, because that 88% is the difference between getting some mild symptoms at home versus getting hospitalized. So I think people really need to look more to the 88% than the 72%. One thing that's also very different with Johnson & Johnson vaccine versus the two that are currently available, this is a one-shot dose. So you get one shot and that's it. You don't have to go back for a second shot. I know the company is currently doing clinical trials for a second shot. They have a group of patients that they're currently doing clinical trials on that will receive 2 doses. And most likely that data, I think, is supposed to come out sometime in May. But people really, if Johnson & Johnson's vaccine gets approved, I think people still need to look at that 88% and not that 72%, because that 88% is going to be a difference between getting hospitalized versus staying at home and getting mild symptoms for a couple of days.
Thank you. And to follow that up, Dr. Mushonga, Dr. Okran mentioned that the Johnson & Johnson vaccine is a 1-dose vaccine. How is that beneficial, and who might we use that for?
So with it being 1 dose, that eliminates some of the concern that, especially in public health, that we won't get people back for the second dose, which is important. Currently, there are measures in place to send out reminders and to encourage people to make sure that they come back for the second dose, because that's the complete series. And so having a single dose makes it a bit easier for community members, community providers, to provide the vaccine, just because it is a bit simpler in the process.
Thank you. I will take a moment to remind everyone to please fill out the poll. We will be looking at the results and answers towards the end of our Q&A session, but please go ahead and take a moment to fill out the poll that Lachelle Wardell presented at the beginning of the Q&A. So, Dr. Mushonga, while I have you here, I'll just follow up because there's been 2 more questions to make sure. When you show up to get your vaccination after you've registered, you're not asked about your ID or proof of health status or about where you work. Is that correct?
You should not be asked about that, especially about your proof of work. Like I said, when you go through that process, you will receive all of the registration information. So once you're invited, you'll receive a link so that you can sign up and register and go through the process. With going through that process, it'll tell you everything that you will need to have, and you'll have proof of your registration, and then that information will be in the system. And Stacy, I don't know if you would like to comment a bit more on that process as well.
Yes, actually, Dr. Mushonga, we are for group 1, since that is occupational-based healthcare worker, we are asking when we activate people to bring a badge, maybe from work or a letter from their employer. We are working on an honor system, as you said. So when you attest on the Wake County Public Health request form that you are a healthcare worker, we take your word for it. When you say you're 65 years old, we might be able to tell from your gray hair, but as long as you tell us your birthday and it matches what you entered when you registered, we're vaccinating you. There is discussion that when we open up to group 3, as the North Carolina Department of Health and Human Services has suggested next week, that we may ask the pre-K 12 and childcare workers who qualify for the first part of group 3 to give us an ID or show us a badge or bring a letter that they work at a health care or a child care facility. So we'll be looking to release more details about how that will all work very soon. But for now, obviously when the firefighters showed up at our public health building to be vaccinated as part of group 1, the folks that are coming across people with COVID-19, their badge was right across their chest or their hat, right? They're identifiable. But yes, if you are able to bring it, that's great. But as long as you attest to it, you should be able to get a vaccine. I hope that helps.
Thank you, Stacy. I'll read this question that came in through the chat. We're trying to get pregnant. Should I hold off on getting the vaccine? If so, how long? And our women's health expert, Dr. Michelle Benoit Wilson, responds, there were women who got pregnant during the clinical trials, and there was no increased risk of miscarriage. It's considered safe for both men and women who are trying to conceive to get the vaccine. Thank you for that excellent question. We have a couple of questions along the line of this one from Kramer East. Should I request any particular brand of vaccine for my situation? Dr. Okram, do you want to answer that question? Can someone or should someone request a particular vaccine?
No, I'll say take whatever it's available. To Dr. Mushonga's point, there isn't a whole lot of vaccines available right now. So I think if you're eligible to receive it, whatever brand is available is what you need to take. The 2 vaccines that are currently approved, both Pfizer and Moderna vaccine, their efficacy rates are pretty much exactly the same. The side effects profile is exactly the same. For the Pfizer vaccine, they had, so far, based on the CDC data that has been released since, I believe, last month, there's been only 2.1 really anaphylaxis reactions versus 1 million people that received the vaccine. And for Moderna, it's just as low. I think this is about 6 for 1 million people that received the vaccine. So whatever is available, I'd say that's what you need to go for.
Great, thank you so much. Dr. Fletcher, I know that you're a pediatrician and have spoken about this, so I'll ask this question to you. From Vielka Gabriel, what are your thoughts about students returning to in-person learning? And do you think this may cause a rise in cases?
That's an excellent question. And we actually have some data from the ABC Collaborative right here in our backyard. to look at this. The study participants were YMCA children in various settings, including inside, outdoors, and a hybrid of inside and outdoors. And it turns out that children are not super spreaders as much as adults are. As a pediatrician, you may wonder, why is that? What makes children different from adults? Well, they're not just little adults. They actually do have smaller lungs. They're not able to produce as much sputum when they cough as adults. And so we don't quite understand why, but the data is proving that the spread amongst these 54 camps, there was no evidence of child, based on contact tracing, no child to adult spread. There was, I believe, one case of a child-to-child spread and a handful of adult-to-adult spread. So if you are a teacher, it's just, we do want to encourage you to wear your mask. Obviously, we want the teachers to be provided with all the PPE and supplies that they need. And also they are essential workers as well, so they should be vaccinated.
Thank you.
And then I'm sorry to follow up. I also want to put a plug into that as a pediatrician, we know that children thrive inside the classroom. And so we do want to encourage children to be in person if it's right for their family. There's no right answer for every family. Obviously, if you're worried about COVID and you have a high risk condition for the adults, but we're happy to see children back in the classroom.
Thank you. This question is for either Dr. Mushonga or Stacy. Can you address why some people, depending on where they're going for their vaccine, will be asked to produce a health insurance card? So we've already discussed that there is no cost for the vaccine. Why are some people being asked to provide their health insurance card?
Dr. Mushonga, I know, having been in our clinics, that we definitely at Wake County Public Health do not ask for an insurance card. I don't want to speak to it. I have read, and that's a dangerous statement to make, but that some private providers or hospitals, if you do have insurance, may say, we know you're insured, we'll enter it in our insurance. But I should only speak really for Wake County Public Health, and at our 2 indoor mass vaccination sites, as well as our community partnership outdoor drive-through vaccination site at PNC Arena, we are not asking for insurance.
Great, and we only have a couple of minutes left, but I have a couple of really important questions I want to make sure we get to. So, Dr. Okram, if you can start. I've heard some people saying that there may be a tracking chip in this vaccine. Is there any truth to this? And that question comes from Amy Castillo. Dr. Okram, what's in the vaccine, and is there a tracking chip?
No, there's no tracking chip in the vaccine. I pull up vaccine doses, several times every week from all our clinics. It's a liquid. The Pfizer dose is 0.3 mL, a tiny little dose. Moderna dose is 0.5 mL, a tiny little dose. I'm not even sure if the amount of liquid is big enough to hide a chip in it. Also, if you go to either of the company's website, they have all the ingredients. If you pull up the EUA from the company's website, it has every single ingredient that's in the drug listed, including all the inactive ingredients with long chemical names. It's all listed in the package insert. So there's nothing related to computer chips in any of the vaccines that it's available.
Thank you. I'll ask you this follow-up question. If Moderna and Pfizer are confident that their mRNA vaccines will almost 100% prevent death and hospitalization, why did they seek and obtain immunity from liability related to their mRNA vaccines? Dr. Okran, I wonder if you can answer that question. Why would drug companies seek liability related to vaccines if they felt so sure about them?
I don't know 100%. If I had to guess, I'll say whenever you're doing clinical trials, it's a controlled environment. Both Pfizer and Moderna had about 30,000 participants split between the patients, the ones that received placebo and the ones that received the drug. Sometimes after you're done with your collecting all your data and the drug is released back on the market, now it gets into the large population. So now you go from 30,000 to millions and millions of people. And, sometimes when it gets to the general population, there may be a few things that you never saw during the clinical trial. So maybe that might be the only reason I can think of, but other than that, I'm not 100% sure why.
Thank you so much. And I think we're down to about our last question. Dr. Fletcher, I'm going to send this one to you. From Rachel Johnson, do you expect young children to have the same response to the vaccine as adults? What do we know about that, and where are we with clinical trials in children?
That's a really great question. The Pfizer vaccine trial is currently undergoing for children ages 11 to 15. And then after that, they're going to go to 5 to 11. But we don't know yet. But if you look at similar vaccines, for example, flu vaccines, that's exactly what they're going to be studying, like what dose is appropriate, how many doses are appropriate for children, because they may not respond in the same way that adults do, since their immune system is not as robust.
Thank you. And I know I said that was the last question, but I may have one more last question for Dr. Mushonga. I think we have time. From Paul Alston, are you aware of direct efforts to educate migrant workers or frontline workers, such as fast food restaurants, supermarket employees, or retail workers about the COVID-19 vaccines?
So we do have a group of community ambassadors with Wake County. These ambassadors can go out to businesses in areas that might have questions or concerns, or sometimes if we receive information that they're wanting more detailed resources, these individuals will go out and share that information with them. So we are looking to expand and share that information with the community, as well as partnering with our partner groups like El Centro, who is focused in the Latinx and Hispanic community, to share this information broadly.
Thank you so much. Well, I think we have come to the end of our question and answer session. Thank you so much to all three of our experts who were able to help answer our questions on the COVID-19 vaccine. At this time, I'm going to turn it over to Lachelle Wardell to look at the poll and see what our poll questions look like.
All right. Thank you, Dr. Rasheeda, and thank you to all of our panelists and to all of our doctors that were providing answers in the chat. We're getting lots of feedback saying that this was a great informative session. And so thank you all so much. I hope people's questions got answered and they were able to ask the questions that were on their hearts and minds. So thank you, everyone. So Stacy, if you will post the poll link again, we still only have about 12 folks in there who have completed it, and we do want to get your responses. But I am going to show you the results of the poll that we have so far. So if you will give me a quick moment and a little bit of patience, I will share my screen here to be able to pull up the poll results. All right. So you should see those at this point. So I'm going to scroll up to the top of the poll so we can see the results. So far we've got 12 participants. You can still get your responses in. And we see where we've got the zip codes coming in from that have participated. 67% of our participants have identified as Black or African American, 11% white, 11% Asian, and 11% other. And then 89% are not Hispanic or Latino. The populations that are represented here tonight, I'm happy to report that 55% of our participants were general public, 27% came from our public health practitioners, 27% were community organizers, we had 9% faith leaders. And then for our age range tonight, we had our largest group coming from the 45 to 65 age range, with the next group being 27% coming from that 25 to 45 demographic. So this was a question that I was really interested in knowing more about, is whether people plan to get vaccinated. 45% of you said you're already vaccinated. 27% said that you will get vaccinated once it's your turn. 9% were on the wait list. 9% weren't planning to, and 9% weren't sure yet. And then, of course, 50% have already been vaccinated. When we asked you why, if you weren't planning to, why or why not? 25% said other. One person said, I'm not sure that the vaccine will protect me from COVID. Another person said they thought you could get COVID from the vaccine. Another person said they thought the vaccine was developed too quickly and it wasn't safe. For this next question, we had 8 respondents to this, and we asked you, who do you trust to provide you with reliable information about the COVID pandemic and vaccine? So 73% of the respondents, meaning 8 people, checked that they trust their healthcare worker. 64% said Governor Roy Cooper. Another 64% said Dr. Anthony Fauci, the Centers for Disease Control. County government officials was up there next, followed by faith leaders, family or friends, President Biden. 3 people said community workers. 3 people said the state government officials. And then we get to radio and media, and that was only 1 person. So that was our poll tonight. That was, and I'm going to stop sharing. You can still complete the poll. We ask you to subscribe to the channel, and you can still complete that. We will post the poll, so you still have time to go on and complete that. And we also ask you to be on the lookout for future sessions. This is the first of a series, so please be on the lookout for that. At this point, I will turn it back over to you, Dr. Rasheeda.
Thanks so much, Lachelle. We appreciate everyone spending the evening with us and sending in your wonderful questions that were thought-provoking and really, kind of challenge us to think, how do we need to educate our community? How can we overcome some of the barriers and dispel some of the myths and build trust around this vaccine? So I'll open it up to each one of my panelists for your final remarks. What would you say to someone who's still considering, is the vaccine for me? Is it safe? Is it okay? What are the parting thoughts that you want people to leave with regarding the COVID-19 vaccine? And Dr. Mushonga, I'll start with you.
Yes, so I have been in this operation for Wake County from the beginning, from March, and have seen from when we had 1 case to we are over 72,000 cases in our community. Having the ability to have this vaccine to be able to keep people safe, keep people out of the hospital, and keep people from dying is something that is so important and allows us to continue to see the work that's being done in our community. This is a part of what we still have to do to keep everyone safe. Having this vaccine is that extra layer of protection, as well as maintaining our 3 W's and being safe. So I know if some people were on the fence, we hope that tonight has at least enabled you to see some of these questions, get some of your questions answered, and make you more secure in that your decision to move forward.
Thank you. And Dr. Fletcher, what are your parting thoughts? What do you want people to remember from tonight?
Well, I just want to leave with the thought about COVID and the fact that it's unknown. You know, everybody who gets COVID doesn't present the same way. Some people have no symptoms. Some people might have a cold. Some people become very ill, hospitalized, and some die. And that may be why there's a lot of unknowns and why people feel like maybe they can gamble with COVID. But this is not just the flu. Let's not give in to that thought that this is something, you know, like a cold. You really don't know how this will affect you. And so we're learning that now Americans, since this pandemic started, 500,000 people have died from this. And I would hate for someone who had a vaccine potentially available to them to pass away from something that we now have a vaccine that is safe and effective. And if you, don't want to necessarily do it for yourself, I want you to think about your loved ones, those that are high risk. Think about your community and the fact that we honestly need about 75% of people vaccinated to have herd immunity so that we can get back to normal. So if it's even something as simple as I just want to see my family and travel again, that's a good reason to do it.
Excellent, thank you. And Dr. Okran, what would you say to people who are still nervous or reluctant to get the vaccine? What do you want them to think about?
I will tell everyone that COVID is real. I work at a hospital. I see this every single day. I've seen pre-COVID and I've seen what we're currently in every single day, where every single day the hospital is full. We have some that come to the hospital that don't make it out of the hospital. I've had my own family members that didn't make it from COVID. The data that's out there shows that the vaccines work. They are very, very effective. My own wife participated in the clinical trials. She was ready to sign up before she even knew there was a clinical trial site in North Carolina. We've all seen how COVID has impacted our lives on a single daily basis. From our kids being home, my son has taken over my TV. You can't even get to watch TV anymore. So I think if we have vaccines that are available that work and are effective, then I think we all need to do our part to make sure we all take the vaccine, because we all want to get to the normal life. We all want to get to where we can go see family members. We all want to get to where you can call a friend and say, hey, what are you doing on Friday? Let's go play a round of golf, or let's go, do something. We all want to get back to that life. So I think we really need to do what we can to make sure people get the vaccine. And, if there's anything that you wanted to ask, that you were able to ask, if you wanted to reach out to me privately, you can, because I'm ready to do whatever it takes to make sure people get vaccinated. And I really enjoyed, my time this evening with everything that we did tonight, so.
Thank you all so much. It has been an absolute pleasure, Dr. Nicole Mushonga, Dr. Jamila Fletcher, Dr. Edward Okran. I really appreciate your expertise and your words of wisdom this evening. I do want to remind everyone that this is the start of more conversations. We will have more Ask the Doc or Ask the Expert conversations, and we look forward to engaging with you in the future. We also want to remind you that we have equity clinics scheduled this weekend in Garner, Raleigh, and Fuquay. So Black and Brown seniors can sign up by contacting their churches. I know several of you will be working with me in Garner on Saturday to deliver up to 2,000 doses of COVID-19 vaccine to our most vulnerable populations, and we're very excited to do it. So if you are interested, please contact your churches in the Garner and Southeast Raleigh area to get on their registration. And with that, thank you so much to the audience for your participation. And thank you for answering our poll. We appreciate you, and good night.